All right, time you guys for your health check. The FDA warning us about some hand sanitizer produced in Mexico, which are apparently considered toxic. Take a look here. There are 9 products deemed unsafe. They include All Clean hand sanitizer, the Good Gel antibacterial hand sanitizer, and several clean care products. Now, here's what happened. The FDA says the products contain methanol, which is a toxic substance, okay, not ethanol, methanol. So do not use those. For the full list, text the word hand to 214-977-6028. Good Morning America is going to have more on this right after daybreak. Look, we've all been talking about it all morning long. COVID-19 cases and hospitalizations are spiking in North Texas. So joining me now is Dr. Carlo, president of the Dallas County Medical Society, to help me answer your questions. Dr. Carlo, thanks for your time this morning.
Thank you.
So a bunch of viewer questions. The first one, just wondering about the spike. Where is it coming from? Is it just sort of related to the larger number of people being tested? What do you say to this?
Well, I'm not sure this is a spike. I think what we're seeing is not only the number of tests are positive, but the percentage of positive are going up. And the reason I don't think it's a spike, I think we're just seeing a trend of rates going up. We really never went down in terms of a wave. So I think that it's both. And it's certainly concerning that not only the number of tests are positive, but also the percentage of tests are positive.
So I'm also hearing a lot from people who work inside hospitals saying our COVID units are full, our ICUs are full. We're going to expand the COVID units. Can you explain this to people who don't know what a COVID unit looks like or what that even means?
Well, so what hospitals have been doing with the coronavirus patients is they've been very, very careful with isolation procedures and have created often special units that are dedicated just for taking care of coronavirus patients. And obviously this is a benefit so that those that are not sick with coronavirus can be very, very well protected. So those units are really scaled to the size and the number of patients that they're seeing because it is such a specialized unit. And so, yes, as the hospitals are gearing up and seeing more patients, they're expanding those units. And certainly that's kind of the effect of what we're seeing.
Okay, so masks. A bunch of people I've seen, at restaurants and coffee shops, they take them off, they put them on the table, or they throw them in their purse. How should we be handling these masks when we take them off and put them on?
Well, it is tricky to take care of masks and do good hygiene with mask wearing. The main thing that you want to do is not touch the front of the mask when you're putting them on or taking them off. Or even, I notice they are uncomfortable, they itch and they can bother you, but try to leave the mask alone when they're around your face, because oftentimes that could create opportunities for you to contaminate your hands. So you want to remove masks by, whatever is around the back, and take those off. And then again, avoid touching the front of the mask. And really then, make sure that you place the mask. If you're going to put it down on, a surface, be wary of what that surface is, and, think about that surface being contaminated. So there are some practical things you should be doing, particularly when you're taking on and off a mask in a public place.
Okay, Dr. Carlo, thank you so much. We appreciate your time this morning.